All right. Hi, guys. Welcome. This is the digestive system for anatomy and physiology. We're going to jump down into this today, and we're going to talk about structure and function within the digestive system. Okay. So here we go. In the digestive system, we're going to be kind of focusing around four essential questions. The first of which is, how do animals and humans obtain nutrients from what we eat? What happens if we don't obtain the nutrients that we need? How do we eliminate waste from the body? And what are some common disorders that can affect the working of the digestive system? We're going to cover the first three in this screencast. The last one is a separate screencast, part 2, where we'll cover the digestive system disorders. Right? The picture that you see of the woman with her hand in the cow is actually in a veterinary clinic. This is a common procedure that's done in a lot of vet clinics. This is called a fistulated cow. And what this means is that cows have a couple stomachs. They have 4 stomachs, and the stomach is called the rumen. And what this lady is doing is actually putting her hand through an opening that was surgically embedded into the rumen of a cow. And what this allows the veterinary clinic to do is 2 things. First of all, it allows them to study the digestive process of a cow. So they can feed a cow a special type of food and then track it the whole way through the digestive system of that cow. The other thing that this allows them to do is a medical procedure where they actually take some of the contents of that stomach of the cow, and they will put it into another cow that is having some sort of problem with an imbalance of the bacteria inside of their stomachs. So a lot of the herbivores, like cows and horses and rabbits, are herbivores, meaning they digest plant products. And those organisms actually don't produce their own enzymes to break down the main carbohydrate inside of plant products, which is called cellulose. So inside of this cow's stomach, it hosts bacteria that help break down the cellulose so that the cow can get nutrients from eating grass. We lack these bacteria, which is why, unfortunately, we can't go outside when we're hungry and get a mouthful of grass or tree or branch and break that down for energy. So a cow that is lacking some of these bacteria, they can actually use this fistulated cow, scoop out some of the gross stomach contents that contains that bacteria, and they can donate it to the cow that might have an imbalance of that bacteria. And it'll help that bacteria set up a new colony inside of the cow with a deficiency, and hopefully that cow would be cured. So fun fact about fistulated cows. All right, so let's start our discussion today on the digestive system with a really famous experiment. This is an experiment that was recorded by a man named James Lind. He was in the Royal Navy, and back in the times of sailing boats across the Atlantic, across the Pacific, and times of exploration, there was a huge problem with sailors getting really sick on board. If you think about the lifetime or the life of a sailor, their diet was a little bit different on sea. They had to eat mostly stuff that would either come from the ocean or would preserve and travel really well in the bowels of a ship. So James Lind wrote about, I noticed its first attack upon myself by the swelling and the bleeding of gums, followed by the swelling of the legs below the knee. I lay day after day enduring the most intense suffering of pain in the limbs, which had turned completely black. So James Lind was actually one of the first people to do a reported clinical trial on a disease called scurvy. And we might all think of scurvy and think of citrus, but James Lind is the guy who first discovered that. So what he discovered is that a lot of animals create their own vitamin C or have the ability to produce vitamin C. We actually cannot. So humans cannot produce their own vitamin C. And because of that, when these humans were on the ship sailing on these long voyages across the sea, they would start to lack vitamin C in their diet. If you lack vitamin C, it means that we can't produce a really important protein for connective tissues called collagen. And what that means is that all of the connective tissues in your gums, your ankles, your feet, your extremities would actually start to break down. So their extremities would get black blisters and sores. They would be bleeding from their gums, swelling from their extremities, and very, very, very painful. What James Lint decided is he wanted to test these sailors. He did the first medical clinical trial. He took groups of these sailors and he tried feeding them different things to see whether or not diet had anything to do with this condition called scurvy. And of course, we figured out that that was the case. He discovered that feeding them citrus, which is really high in vitamin C, would help very, very simply cure these sailors and get them back up on their feet. So this is one example of how we have kind of learned through trial and error about our digestive system. Today, as we discover the anatomy and physiology of the digestive system, we're going to kind of start from the top to the bottom, and we're going to go through each of the parts of the digestive system. Right? When we look at the digestive system as a whole, it consists of kind of two parts. The first part is going to be a long alimentary canal. So basically, humans are just big tubes, one end starting with your mouth and ending with your anus. And along the way, that tube is going to twist and coil and have several different shapes and functions. It's also going to be joined with things called accessory organs, so things like the liver, the gallbladder, the stomach, the pancreas, these things that are going to help kind of access this big, or help support this big long tube that we are in, right? So if we look at this alimentary canal, we also call it the gastrointestinal tract. We can break that word down. Gastro means stomach, intestinal means intestine, tract means tube. If we start at the top and we work our way down, it's going to start with our oral cavity. So it's essentially going to be our mouth, our tongue, leading to the back part of our throat. In anatomy, the word pharynx is our throat. The pharynx is going to lead to the esophagus. The esophagus leads to the stomach. Stomach goes to the small intestine, and the small intestine leads to the large intestine, and eventually out through the anus. The accessory organs that help aid the digestive system in that alimentary canal we discussed are things like the liver, the gallbladder, and pancreas, and we'll go over their functions a little bit later. Some other things that we'll go over that kind of help aid in digestion are things like teeth, tonsils, and salivary glands. Right? So let's first start by talking about the structure of the actual alimentary canal, so that big long tube that is inside of you. If we would cut that tube in half, we do a cross section, we would actually see that there's a couple different layers that make up that tube. And these layers are pretty important for the function of that tube, right? The first layer is actually, we're going to start from the inside out. The first layer is called the mucosa. And if you think of that word, it kind of sounds like mucus. And there's a reason for that, because mucus is secreted by glands in the mucosa and the submucosa. So that word mucus actually comes from mucosa. This mucosa is in charge of two things. The first thing is we need to make sure that we're protecting the tissues of our body. So if our main canal, our main gastrointestinal tract, our main alimentary canal is in charge of digestion, we need to make sure we're not actually digesting ourselves. So the mucosa is a layer that's going to protect the remaining layers of tissues in our alimentary canal. The other job of the mucosa is through absorption. And we'll talk about these structures called microvilli that are inside of our mucosa in just a little bit. If we move outside one layer, the submucosa is going to contain glands and blood vessels and a lot of nerves that control the function and the movement and the contraction of that alimentary canal. So mucosa is this layer in the center. The submucosa would be just outside of that layer, containing the blood vessels and the nerves. Outside of the submucosa, we're then going to have two layers of muscle. We're going to have a muscle that runs longitudinal and a muscle layer that runs circular. The inner circular muscle essentially runs around the canal, and when those muscles constrict, it would actually make the canal skinnier. When the longitudinal muscles that run lengthwise in the canal constrict, it would make that canal shorter in length. The outside layer of our alimentary canal is going to be called the serosa. And that's going to be something that helps lubricate the surface of the outside of our intestines and large intestines. And this is pretty important because if you think about your abdomen, you need a lot of motion in your abdomen. So even right there, as you're watching the screencast, do a little twist. So move your shoulders back and forth, twist your abdomen so that you're kind of going opposite directions with your pelvis and your shoulders. And as you do that, you're twisting that abdominal cavity that contains all of your intestines. And it's pretty important that those intestines are able to slide and to kind of move around inside of your abdominal cavity so that you can get that movement, right? This is a great diagram to help you remember the layers of the alimentary canal. This is looking at the canal as if we are taking a cross section or transverse section. If we start on the inside, we put delicious McDonald's fries because that's where the food is actually going to go to be absorbed. The first layer is called the mucosa. The next layer would be the submucosa. Then we have those two muscular layers, one longitudinal and one circular. And lastly, we would have the serosa around the outside that helps lubricate our canal. In that mucosa, we talked about, I alluded to the fact that we have these things called villi or microvilli within our intestine. And what that means is that the inner part of the mucosa, if you would zoom into the part of the tissue that comes in contact with the cavity of that mucosa, we'd have these long finger-like projections that actually are extensions of the cells of the mucosa. The reason for these extensions are that they help increase surface area. If you think of food moving past these long finger-like extensions, the surface area being increased would allow us to have more opportunities to absorb those nutrients. When we kind of zoom back out and we look at the digestive tract as a whole, there's 6 main functions of them. The first function of the digestive tract, or the GI tract, is going to be ingestion. Ingestion means to bring food into yourself. So this is going to include the mouth and the teeth, and this is going to be how we essentially get food into us. The second function is called mechanical digestion. So when you think mechanical, think of like moving parts. So this would be the crushing, the sharing, the chewing. That would basically take the food, let's say the apple that you're eating, and it would mush it, crush it, shear it, put it into small pieces so that we can move it through our GI tract. This third function of the GI tract is chemical digestion. So now this is happening at the chemical or the molecular level, where we're breaking down little tiny organic compounds and we're getting them ready for absorption. The fourth function is going to be secretion. So this is when we produce buffers, enzymes. We produce these hormones that are going to help us digest the food that we are eating. It's also going to help us release water, create these things called buffers, which help us kind of regulate our pH level. The fifth function is absorption, and this is a pretty important one because our digestive system is in charge of getting food from the outside of us to the inside of us and distributing it to all of our cells. So this absorption is going to be when we move the organic molecules that have been broken down and we expose them to the inner cells of our GI tract so that we can diffuse them into our blood and then ultimately our cells. The last function of the GI tract is elimination. So this would be the removal of any of the food that we cannot digest through defecation or feces, right? So this is a good point. If you are in the screencast and you're by yourself, why don't you pause here? So push pause and then take a look at these 3 questions. See if you can go back and answer these 3 questions. If you can answer them without looking at the screencast, even better. If not, pause the screencast. And then if you can't answer them, go back and make sure that you look up the answers. Okay, moving on. We're going to start at the digestive system kind of from the top to the bottom, and we're going to work down through each of the structures and what it does for digestion, starting with the oral cavity. So the oral cavity has a couple different functions. The first one is just sensory. So we need to know what we are eating and what we're putting into our mouth. So you can think about our tongue helps us with that, our lips help us with that, and our taste buds help us with sensory of what we are actually eating. I'm sure many of us have had the experience where you go to bite into an apple or you go to bite into a strawberry and it has either some dirt on it or some chemicals on it before you wash it. And you get that feeling of oh, this doesn't taste right. And that's your oral cavity working for you, making sure you don't ingest something that isn't going to be safe for the rest of your body. The second function is mechanical processing. So this would be that mechanical digestion we talked about before. So using the teeth, using the tongue, using what are called the palatal surfaces, which is your upper palates, you're going to be able to process that food and break it into little pieces. Oral cavity is also going to help with lubrication. So we produce mucus and spit and salivary secretions through our salivary glands that are going to help lubricate that food so that if we're eating something really dry like French bread, we can lubricate it and move it down through our GI tract more comfortably. The last function of the oral cavity is the beginning of digestion. So digestion actually happens, and it starts to happen in our oral cavity. One of the enzymes you want to keep an eye on, you want to know, is an enzyme called amylase. And amylase breaks down carbohydrates like starch into really simple sugars like glucose. So a great example of this is if you eat really dry crackers that are high in starch, when you first put them into your mouth and they mix with the spit, which contains amylase, you'll start to feel them break down really quickly. And that's that enzyme in action. So I'm going to play this really quick, but I'm going to play it on
Swallowing occurs
mute because this shows us the process of eating and swallowing. All right. So the very first thing when we take that bite of apple is we're going to go through mechanical digestion and we're going to move that food using our tongue, which first of all, look how thick that tongue is. We always consider our tongue being just the part that sticks outside of our oral cavity, but it really is a really large muscle. We can also see the palates or the palatine structures, so hard and soft palate, working to help us break that food down. In this part of our pharynx, we have the uvula, which hangs in the back, and we have this structure here that's flipping down called the epiglottis. Right? And that epiglottis will help divert food away from this trachea part, and it will divert it backwards towards the back of the throat into the esophagus. As it moves down the esophagus, we'll learn that this is an actual muscle contraction called peristalsis, and it will move that little piece of food down the esophagus, down, 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 down into the stomach. It passes through this thing called the cardiac sphincter in order to do that. And this slow movement of the muscles is what's going to help us continue to move the food down into our stomach. All right. So we talked about the oral cavity. Let's talk about the parts of the oral cavity that we didn't cover yet. If we look at the oral cavity from the front to the back, we of course have lines of teeth and gums. The hard palate, if you kind of put your tongue right behind your top teeth, you should feel little ridges. And those ridges of your hard palate kind of show you the part of your oral cavity that is supported by bone. So your hard palate has bone behind it. If you keep sliding your tongue backwards in your mouth, you can kind of find the cavernous indentation of your soft palate. And your soft palate doesn't have bone behind it. It's a very soft piece of tissue that separates your nasal cavity from your oral cavity. Hanging down from your soft palate, you have your uvula, which is going to help you with your choking gag reflex. It's also going to help figure out what size food chunk you can put down your esophagus. Behind the uvula on the left and right side, we have tonsils, which we'll talk about in a moment. And really that those parts are going to work together to help us eat. Also, if you move your tongue completely up to the roof of your mouth, you'll notice that there is this connective tissue from the floor of your mouth to your tongue. And that's going to be called the frenulum. And that's essentially what helps hold that muscle down. If we look in the back of the mouth, this person actually has inflamed tonsils. So these two things, two structures between the uvula are tonsils. These tonsils work as part of our immune system. So if you think about all of the vulnerable parts of our body about getting sick, the parts that are exposed to the outside world are going to be the parts that bring in bacteria and pathogens. So it's pretty smart of our immune system to have the tonsils set up in the oral cavity. That way, anything that is swallowed, anything that is eaten, If it does contain pathogens, the tonsils will secrete immune cells that can start fighting off those pathogens as soon as it enters the body. Tonsillitis, you can see the word tonsil there. Itis means inflammation of. Tonsillitis is just going to be when there is an infection inside of those tonsils. It can cause a sore throat. Sometimes you can feel inflamed lymph nodes and tonsils in your throat if you are sick. And in some cases, they become so problematic that you go through a tonsillectomy where they are actually removed. Fun little fact about your tonsils, they create these things called tonsil stones or tonsillets. This is basically just a collection of bacteria, debris, some lipids that will get caught in the layers of your tonsils and the little ridges of your tonsils, and they'll accumulate. And sometimes you can see them in the back of your mouth, and sometimes they'll actually kind of dislodge and you'll feel them in your mouth and you can just kind of spit them out, right? So after we kind of move in your oral cavity, we kind of notice that there are these things called teeth. And really cool thing about this image that you're seeing is that this is showing you secondary teeth and it's showing you baby teeth. So we can see down here, there's a row in our lower mandible of secondary teeth that are pushing these baby teeth up and out. So all of us probably went through the process of losing our baby teeth pretty early on in life. And hopefully by the time you're sitting in my high school classroom, you're looking at all adult teeth and that the tooth fairy has been good to you. When you look at the types of teeth we have, you could study this for months, especially if you go into dentistry. But the first 4 teeth in the front, top, and bottom of our mouth are called incisors. Those are sharp and they're meant for shearing. Then we have our cuspids, which are sometimes called our canines. Those are our pointy ones. Then if we move back, we have 2 bicuspids, which have 2 points to them. And then we have our molars. So there's the first, second, and third row of molars of our teeth. Really huge misconception about teeth is that people think they're a solid structure, all white, kind of like a stone that's just lodged in our jaw, and that's absolutely not true. Teeth are living, they're made out of tissues, and they actually can bleed. So your teeth, just like your bones, are pretty complex and have different layers. Overall, they're made out of the crown, which is the part that you see when you look in the mirror, and then the root. And that root is what kind of help anchor it to the bone of your mandible or your maxilla in your head. But you can see in the center of the tooth, there should be this area called pulp that contains the nerves and blood vessels. And those nerves and blood vessels go the whole way down and they'll actually connect with the rest of your nervous system and your circulatory system. The reason why this becomes an issue is if you have poor dental hygiene, like this poor little kid, you will crack the crown or cause decay in the crown, which will expose that inner part of the tooth to decay into bacteria. And when that happens, it's a really, really hard place to access. Therefore, infection can set up and the teeth can decay from the inside out. When you have that decay that's really deep in the tooth, it's called a root canal. And essentially what you could do in a root canal is you will go to a dentist, you'll go to an oral surgeon. They will drill out all of the decayed tissue. They will scrape out all of the decayed root. They will pack it with some sort of substance that will stay pretty hard throughout the rest of your life. And then they will construct a new cap, which they kind of design and shear and file and smooth down to match the rest of your teeth. And that basically means that tooth is no longer living from the inside tissue, but it also means that it won't decay anymore and it probably will not cause you pain either. Many of you guys, if you're sitting in a high school anatomy classroom, might over the next couple of years have a conversation with your dentist and they give you the good or bad news about your wisdom teeth. A lot of times wisdom teeth come in, and when they grow in the very back part of your jaw, if you don't have enough room in your mandible, they can actually come up, called erupting, in a not straight angle. So they can arrive angular. They can erupt partially, so maybe they're not going to be pushed up the whole way. Some people's wisdom teeth actually come in horizontally, which is what you're seeing in the X-ray at the top of the screen. And sometimes they'll come in normally, which is vertically, and they'll just push up. Because of those different angles, some people will need to have their wisdom teeth removed, and other people can live the rest of their life with their wisdom teeth, right? Another portion of our oral cavity that helps the digestive tract are these things called salivary glands. And these salivary glands contain mucus cells that will secrete mucus and spit that will help with lubrication, and will also secrete the enzyme amylase we talked about before that breaks starch into sugars. We have 3 different types of salivary glands. The first type is called the parotid gland, and those are in kind of your cheek area, kind of the back of your throat. They will secrete saliva into your oral cavity. Second type is called submandibular. And if you break that word down, sub means below. Mandible is our jaw. So these are the glands that if you kind of feel the angular part of your jaw and you move it back and forth, these would be glands that are seated just kind of beneath that area. And the last type are called the sublingual glands. Sub, again, meaning lower or below. And then lingual is a reference to the tongue because that helps us create words, which is linguistics. So the sublingual gland people love to talk about is the one that if you lift your tongue up and you push on that sublingual gland, you can actually shoot a little bit of saliva out of there. It's called gleeking. But that's essentially where that saliva comes from, right? So we're starting with the top of the digestive tract. Let's start moving our way down from the oral cavity into this area called the pharynx. If you're jotting down notes at this point, it'd be important to reference that the pharynx is commonly called in layman's terms the throat. And it's divided into 3 different parts: the nasopharynx, naso meaning nose. So that would be this part up here that connects to this nasal cavity. The oropharynx, oro, root meaning oral, meaning mouth. So that would be this part here that connects to the mouth. And then the laryngopharynx. And if you see the word larynx in there, the larynx is going to be the part of your throat where the trachea opens up. So from the top to the bottom, it's the nasopharynx, the oropharynx, and then the laryngopharynx, right? This is such a cool video. This is a X-ray of somebody who is chewing and swallowing. So they essentially gave a little bit of food. You can see them go through that chewing process, and then as they swallow, you can see the soft palate raises, and that little piece of food goes down here into the esophagus. The one thing I really want you to look at, and I'm going to pause it here, is I want you to look at this, I want you to look at this little structure right here. It's kind of hard to see in this moment. This is called the epiglottis, and we're going to reference this in a little bit, but I think in this video you can see it so well. This epiglottis is kind of default up. And what that means is as this person breathes through their nose or their mouth, that air is very easily able to go through past their epiglottis and down into their trachea. However, what I want you to look at is when I push play and they do take a bite of food or a swallow of water, that epiglottis will come down like a little trash can lid, cover up the trachea, and instead divert that food or water down back into the esophagus. So in the front here, front of the neck, you can feel in your own neck the ridges of your trachea. The trachea is in the anterior side of your throat. Then just behind it is this tube, the esophagus, and then you can actually see the vertebrae, which would be right posterior to that esophagus. So if I play it again, you can see that little epiglottis flip down, covers up the trachea, and then it moves. There's the epiglottis right there. It moves that fluid down behind the trachea into the esophagus. So a pretty cool shot about how swallowing actually happens. All right. Speaking of the esophagus, let's talk about that for a second. We've moved on from the oral cavity, from the pharynx, and now we're in the esophagus. So the esophagus is a muscular tube. It's kind of squishy. If you've dissected pigs or cats at this point, you've kind of seen that structure. It's about 10 inches long and it's about 2 centimeters wide. So that's about the thickness of your thumb in diameter. And the purpose of the esophagus is that it's going to connect the oral cavity to your stomach. It also is going to be controlled by muscular movements called peristalsis, which we'll talk about in a second. In the digestive tract, we have a lot of smooth muscle. So your esophagus is made out of smooth muscle. Your small and large intestine is made out of smooth muscle. And the reason for that is that smooth muscle is underneath non-voluntary control. So what that means is we don't have to sit here and think. We don't have to make a decision about swallowing and moving the food through our intestinal systems. There'd be a lot of work to sit in the middle of class and be thinking about moving the lunch you just ate through all of your intestines purposefully. So that smooth muscle is controlled by the inner brain stem to kind of make sure that you are digesting and moving that food where it needs to go. To do that, your body is going to trigger that smooth muscle to go through a set of rhythmic circular contractions, and that's called peristalsis. Those contractions kind of move like a wave, and as they move throughout your esophagus, your stomach, and your intestines, it's going to move a chunk of food along that digestive tract. The anatomical and probably less disgusting word for chunk of food is called a bolus. So once that smooth muscle is stimulated, it will trigger the contraction of the muscles to kind of move that bolus along the digestive system. In the digestive system, that's not the only thing the smooth muscle does. The smooth muscle can also go through mixing movements. So we'll see that in the stomach, but the propelling movement is primarily peristalsis. And if you look at the image to the right, you can see that we have those 2 layers of muscle, the circular muscle and the longitudinal muscle. As the circular muscle contracts, it's going to actually make that tube narrower, which squishes that bolus down. And then as the longitudinal muscle contracts, it's going to actually shorten that segment of the esophagus or intestine, and that's going to move the bolus forward in the digestive tract. So the combination of those 2 things kind of work like a wave. The bolus is going to move from the mouth to the anus through the contraction of these 2 layers of muscles. They contract, it moves the bolus forward. They contract sideways, moves the bolus forward. And through that wave-like contraction of peristalsis, that bolus is going to be projected forward. If this is normal peristalsis, so from the mouth to the esophagus to the anus, what do you think reverse peristalsis is? It's going to be not so pleasant process of vomiting or throwing up. So when we need to get the stuff that we just ate that maybe isn't making us feel so great from the stomach, reverse peristalsis, it through the esophagus and back up into the oral cavity. It's not too pleasant to think about, but a pretty effective tool at getting bad stuff out of our stomach. Speaking of our stomach, that's our next stop. The esophagus that we mentioned before is going to connect to our stomach through a sphincter, that round muscle that's going to contract. And this sphincter is called the cardiac sphincter. This one's a pretty famous one because it's the sphincter that is involved if somebody feels heartburn. So our stomach here we can see is a long, kind of rounded shaped organ that is filled with acid. And if that stomach acid happens to leak through the cardiac sphincter, or maybe we're overproducing stomach acid because of a really poor diet, some of that acid will get into the esophagus. It'll literally burn some of the tissue, make it really uncomfortable and inflamed, and that feeling is heartburn. Heartburn has nothing to do with your heart. It's only called heartburn because your esophagus runs behind your heart. So when your esophagus is inflamed and when it's feeling really poorly, it kind of feels like it's an area of your heart, which is why it got that word heartburn. The stomach also, you can see the inside portion of it has all of these bumps and grooves, and those are called the rugae of the stomach. Those bumps and grooves allow for a couple of things. The first of which is that it allows it to move and contract. It's called churning. That will help us turn over all the food in the stomach, and it'll help us digest that food mechanically. The end of the stomach, so if we follow it down, is going to be the pyloric sphincter. So if you think about it, this sphincter opens up and lets food move into the stomach from the esophagus. The stomach then will digest. When it's ready, it will open the pyloric sphincter, and that will move all of the food downward into our small intestine. The stomach, if we look at it in more detail, is made out of kind of 4 regions. The first region is the region where the esophagus enters the stomach, and that's called the cardiac region. The second region is called the fundic region. I like that word because it has the word fun in it. It makes me think there's fun in the stomach. This bumped area here is called the fundus of the stomach. This is where a lot of times gas will accumulate because it's the highest point. So if you've ever been really hungry and you hear somebody's stomach rumble, that's actually their stomach rumbling around the gas in the fundus, and it's making these little tiny bubbles, which sometimes will kind of create that sound of a churning stomach. The body of the stomach is going to contain the lesser curvature, so that's this side here. So think of this being less distance. And then this is the greater curvature of the stomach. So you can think of the greater distance. And then lastly, it would be the pyloric region of the stomach. And that's going to be where that pyloric sphincter is. It's important to notice too, here is our diaphragm. So in the beginning of this course, we learned about how the overall cavities of the body are divided into the thoracic cavity, which would be above the diaphragm, and the abdominal cavity, which would be below the diaphragm. So our stomach is very firmly situated in our abdominal cavity, right? So this is a great slide if you want to pause it and kind of look through all the different parts of the stomach to review. Inside of the stomach, if we actually look at this image, this is a stomach from a human that's been removed and kind of turned inside out. An important thing to know about the stomach lining is that we create really acidic environment in our stomach. And that means that we need to create mucus on the inside of our stomach to basically stop ourselves from digesting our own stomach tissue. So we can have these little glands in the rugae of our stomach, these little folds that secrete mucus so that the acid in our stomach doesn't come in contact with the tissue, and that it can break down foods without it breaking down our own stomach muscle. Pepsin is an important enzyme to remember. This is going to be an enzyme that really thrives in the stomach. Pepsin is an enzyme that loves a low pH or an acidic environment, and it's going to help us start breaking down proteins in our food. All right. Once the food enters the stomach, and after it's been broken down for some time, it's going to get a little bit runnier. It's going to get smoother. It's gone through that mechanical and chemical digestion a little bit more. As it moves from the esophagus, it's called a bolus, but once it's become smooth and kind of digested more, we call it chyme, which I think is a really gross word. This chyme is kind of like a paste-like consistency, and that chyme is going to then be released into the next portion, which is the small intestine, via the pyloric sphincter. All right. So overall, in summary, the stomach has 3 main functions: the storage of food. So when we are initially sitting down for a meal, we will store all of our food from the esophagus in our stomach until we have a time to actually digest it. It's in charge of mechanical digestion. So that would be the churning of the stomach, physically breaking that food apart. And then chemical digestion. So that would be breaking the bonds in the food, using enzymes to break them down into smaller pieces. The chemical digestion is going to use enzymes. We already discussed 2 of these. Pepsin breaks down proteins. That's an important one to remember. Amylase breaks down carbohydrates like starch into sugar. And then the third one would be lipase. Lipase, you can kind of see the word lipid in it, is going to be an enzyme that breaks down lipids in the stomach, right? The stomach contents itself becomes more and more fluid the longer it's in the stomach. The pH is going to decrease and approaches 2. So on average, your pH in your stomach is about a 2. And as it does, that pepsin activity would increase and protein would start to be broken down and catabolized. All right. And a huge misconception is that even though we are breaking things down in the stomach, we're digesting, very little absorption actually happens there. It's just meant to break the food down into smaller pieces. Okay. It's be a great time to pause the screencast, get up, take a little break, take a little stretch, or find a partner or review with yourself the following 3 questions. If you can't answer them, go back in the screencast and make sure that you find that information. Okay, so we've covered oral cavity, the pharynx, the esophagus, the stomach, and now we are on to the small intestine. The main job of the small intestine in one word is absorption. 90% of all of the absorption, all the nutrients that we get from what we eat comes from the small intestine. So in this class, we've stressed a lot about structure versus function. It kind of makes sense that if the small intestine is in charge of absorption, and that's where 90% of absorption happens, that we want the small intestine to make up the majority of our gastrointestinal tract. And that is exactly what it is. The small intestine is not named after the length of the intestine, because it is actually the longest part of our digestive system. Small intestine is named after the diameter. Inside of our small intestine, remember that we have these intestinal villi. So these villi are going to help us increase the surface area and allow for nutrients to be absorbed more quickly. The small intestine is going to be divided into 3 main parts. The first part is called the duodenum. The second part is called the jejunum. And the third part is called the ileum. And I see there that my M got cut off from the image of the small intestine, but that should be jejunum with an M at the end. Inside of each of these 3 parts of our small intestine, there is this connective tissue called the mesentery that will basically hold all of the intestines together. And it also will contain blood vessels that will collect all of the food, all of the nutrients that the intestines are absorbing, and it will move it into our blood and our circulatory system. So the 3 parts of small intestine, we're going to start with the duodenum, and we'll run through what each of the parts of the intestines really specialize in. The duodenum is actually the smallest or shortest region of the small intestine. It's the closest area to the stomach. So the stomach dumps through that pyloric valve and goes straight into the duodenum. It's only about 10 inches long, and it's known as the mixing bowl. The reason for that is that it's going to receive the chyme from the stomach, it's going to receive secretions from the pancreas and the liver, and it's going to mix all that stuff up. The main function of the duodenum is to get the food directly from the stomach in a state where it's ready to be absorbed in the other 2 parts of the small intestine. So the duodenum is only 10 inches long, and it's just really going to mix everything together and get it prepared to go on to the next 2 sections. Not a crazy amount of absorption is going to happen in the duodenum. The duodenum, if we look here and get our bearings, here's our esophagus going into our stomach. Our stomach dumps it through our pyloric valve into our duodenum. So this would be duodenum. If we look at the duodenum, there's actually a little duct that enters the duodenum right here. It's kind of colored green. And that duct is going to be the combination of what the liver and the pancreas create. The liver is going to produce bile, which is one of the main compounds that helps us break down lipids. Now, not every meal we eat is really high in lipids, so we don't always need bile. So we have this thing called the gallbladder, which will store the bile until we really need it. When we eat a really, really like fatty diet, so we go and we have some fried chicken and some French fries and then some like cake, the gallbladder will release more bile into our duodenum so that we can break down that lipid. The pancreatic juice is going to create a bunch of different enzymes as well that will dump into the duodenum as well, thus kind of confirming that mixing bowl function. The liver, man, the liver does a lot. We're only going to scratch the surface in what the liver does. It's literally nicknamed the biochemical carnival. So if you take biochemistry, there's a lot of processes that happen in the liver that help us filter and neutralize a lot of the things that comes through our blood. However, in terms of the digestive system, it's going to be in charge of creating bile, and it's going to be in charge of getting that bile from the gallbladder into the duodenum. It's a huge organ, so 3.3 pounds on average. If you think about a gallon of milk, that's probably about 6 to 8 pounds. So think about lifting up a half gallon of milk. That's approximately the weight of your liver. And as humans, we have 4 lobes to our liver. The cool thing is the liver is regenerative, so it can actually regrow. If you donate a portion of your liver, you can regrow that and heal it. The liver actually is going to help us filter all of the stuff that comes from our gastrointestinal tract. So in addition to dumping bile into our GI tract, which is shown in green here, the liver will actually take some of the blood from the mesentery of our intestines, filter it, and make sure that anything we are absorbing that is not clean, so think about like drugs, toxins, will get filtered out and put back into a system to help clean it up. The liver also is supported by the hepatic artery and the hepatic veins. That's going to remove oxygen poor blood and supply it with oxygen rich blood. In terms of what the liver does, we already mentioned that it is the biochemical circus or carnival. It also is going to be in charge of processing drugs. So a great example of this is like if you take a painkiller like acetaminophen and ibuprofen, some of those drugs are actually filtered out by your liver, which is the reason why you want to make sure you kind of keep track of how many of those over-the-counter painkillers you take, because it can be damaging to your liver. It can also help us metabolize carbs, fats, and proteins. It removes toxins. It produces bile. It removes old blood cells. Some of the toxins it can filter out would be things like alcohol. So if you ingest alcohol, it can actually filter out that alcohol group, because alcohol is technically poisonous to the body. As it does, a lot of times that alcohol filtration will cause a process called cirrhosis, which is where the liver actually kind of starts disintegrating due to the alcohol. Again, it's a good thing. As soon as you stop consuming that alcohol, the liver can grow back as long as you have enough healthy function of the liver back. The gallbladder is pretty small compared to the liver. It's going to contain and store that bile that's made in the liver, and it's kind of like a pear shaped that's kind of nestled inside of the lobes of the liver. If you've done your dissection at this point in the year, we'll see that the gallbladder is literally tucked up and kind of flush with the inside portion of the liver. A fun connection to something you might have seen before is that a lot of times newborn infants have a condition called jaundice. And this basically means that the white parts of the infant's eyes and their skin have kind of a yellow tint. And that's actually because of an elevated level of a protein called bilirubin. And this bilirubin is a lot of times found in premature infants. If it becomes too high, it can actually dissolve in the body tissues. That's what causes that yellow characteristic in the eyes and the skin. And it's treated just through fluorescent light. So that light will help break down the bilirubin and help that kid get out of jaundice. All right. So moving on from the liver, we have our pancreas. And our pancreas, again, is going to be one of those accessory organs. The pancreas is going to secrete insulin and glucagon, 2 hormones that I hope at this point in your career you've heard about in terms of blood glucose levels. The insulin helps us move glucose into our out of our bloodstream into our body tissues, and glucagon will help us break down glycogen that is stored in areas of our body and release that into our bloodstream to help us elevate that blood glucose level. The pancreas will also secrete what's called pancreatic juice, which is a bunch of different enzymes that will help us break down fat. Both the liver and the pancreas will combine from the bile duct, the pancreatic duct, and they will both dump into the duodenum, that mixing bowl. All right, so that's a lot for the duodenum. The mixing bowl has a lot of accessory organs, but let's move on to the next and the second part of the small intestine called the jejunum. The jejunum is the middle portion of the intestine. If you remember, The duodenum was only about 10 inches long. The jejunum in the average human is 8.2 feet long. So that means you could stretch the jejunum of the average person out and it would be way taller than they are, or way longer than they are tall. This is the location of all of the rest of chemical digestion and absorption. So it's long because we need more time to have those chemicals that we broke down be absorbed into our bloodstream. The small intestine is going to be in charge of absorbing carbs, proteins, fats, as well as vitamins and minerals. The last segment of the small intestines, this is the third segment, is our longest. It's over 11 feet long, and it will lead to this last portion of our small intestine called the ileocecal valve. The ileocecal valve is named after the two structures it is between. Ileo sounds like ileum, and then cecal sounds like cecum. So this is the valve between the two structures of the ileum and the large intestine, the cecum. The small intestine, the ileum is in charge of absorption, and it also is going to kind of absorb the rest of the bile acids that were produced in the liver, right? In our small intestine, it takes about 5 hours to get materials from the duodenum to the ileum. So what that means is that if you eat a meal, technically that meal is inside of you and it's being worked on, digested chemically and mechanically for about 5 hours before it even enters your large intestine. If it's moving more quickly than that, you might want to take a look at how much fiber you're eating. You might want to take a look at the contents of your meal, and it might be an indication that you are a little bit sick or you ate something that your body doesn't tolerate well. So in other words, if you eat and then, I don't know, half an hour later, you really have to use the bathroom quickly, that means something is not right in terms of secretion and absorption, and you probably should work to find balance within your GI tract, right? Everything within the intestinal system, the small and large intestine, ultimately is going to try to increase the exposure of cells to the stuff that you're trying to absorb, right? On the outside of the intestines, we have this weird structure called the greater omentum. And this is actually a membrane that will cover both small and large intestines. You can see it really well here on the right-hand picture. It's kind of a curtain-like membrane, and its job is to lubricate and also store fat. So if you dissect in this class, you'll notice that some of the cats, some of the pigs will have larger or smaller omentums, and those omentums might be really fatty if they're a cat or a pig that was really well nourished, or they might be a little bit more slender and not have as much fat in there because they lived a harsher lifestyle and they didn't have as much fat deposition, right? There's a really famous Dr. Oz episode where Oprah learned about the greater omentum. This was during her weight loss phase. And you can see there, they are actually holding human greater omentums, one a little bit fattier, the other one not so much. That is the main reason why humans store fat in their belly. When you say like you have fat in your belly, you have a fat belly, or if you have a beer gut belly, as some people put it, really what you're talking about is the adipose, that fat tissue being stored in the greater omentum, and that's the area of your body it's going to go. All right, so a great place to stop, pause, answer these few questions, and if you don't know how to answer them, go back into the screencast. Okay, we're going to end things, no pun intended, with the end of our digestive tract, and that's going to be our large intestine. The large intestine is going to be a combination of a couple different structures. The first structure is called our cecum. And in humans, the cecum is just this little region here. We can see here's the ileum. That's the last part of our small intestine. And that is leading here to our cecum. And sticking off of the cecum is this finger-like projection called the appendix. Then we have the 4 sections of our colon. So they're named after the direction they go. So this part of our colon is called our ascending colon, our transverse, meaning across colon, our descending colon, and then our sigmoid colon kind of makes an S shape. So it bends and then bends a second time to make the sigmoidal part, and then it goes to our rectum. Our rectum is in charge of storing waste right before it's expelled from the body and getting rid of any water that it can. And then lastly, our anus is going to be the last sphincter that controls the excretion of waste from our body, right? Now, the cecum in a human is relatively small. If you look at the digestive tract of a human versus a rabbit, rabbits are mostly herbivores, and they have a pretty large cecum compared to a human. The reasoning for that is that the cecum is going to take materials from the ileum, and it's going to store them, begin compacting them, but also it's going to start breaking down some of the undigested materials like plant products, so things like cellulose. The diet of a human is that we're omnivores, so we have a lot of protein and lipids in our diet, whereas rabbits have more herbaceous foods like grasses and seeds and berries. So the cecum is larger in the rabbit because they're going to need to digest more of that cellulose, more of that plant product, right? This would be a great place to kind of pause and fill out your diagrams of all the parts of the gastrointestinal tract, right? So let's end things by talking about the structure of the large intestine and how it relates to the function. The main function of the large intestine is that we are going to try to reabsorb all of the water that was put into the food that we're digesting. Water is a precious resource in our body. We want to make sure that we're not pooping it out if we don't need it, or if we do need it. The other important function of the large intestine is that it's going to be a host, a house, if you will, of bacteria that's going to help us aid in digestion. So we call this our intestinal flora, or sometimes we call it our microbiome. The intestine then is going to be in charge of defecation and removing that undigested food. There's a lot to be learned from poop, and I will not put you through it now, but there is a pretty funny video starring a sock puppet that goes through how everybody in the world poops. Poop is a really valuable tool for diagnosis. So a lot of times if you are really not feeling well, they'll take a urine sample, but they'll also take a fecal sample. And feces, we can learn a lot like through testing our feces, like stuff about our diet, whether or not we have imbalances in our pH. Feces can tell us whether or not we have diseases. It can tell about the function of organs. And it can tell about molecular function as well, so how our enzymes are functioning. So let's talk a little bit about that awkward concept of poop. One of the main conditions that involves poop is constipation, which means that essentially all of that food that's going through your small intestine goes into your large intestine, and then it starts to get really dry and really compacted. So constipation is when there's a lack of water in your diet or in your large intestine, and the material starts to kind of back up. Not comfortable for anyone. The cure for constipation typically is going to be, first of all, to cure that lack of water by drinking more, so making sure you're not dehydrated. The other cure for constipation would be to take fiber. Fiber is kind of a layman's term for the sugar called cellulose, or the macromolecule called cellulose. And since we cannot digest cellulose, our body just keeps on moving it through. So it helps move fecal material along the large intestine. It helps unblock that constipation. This is a fun little chart called the Bristol stool chart. And I mean, we talk about this anatomy because where else are you going to learn about whether or not your poop is healthy? The Bristol stool chart kind of runs the gamut of types 1 through 7. 1 being like the most dehydrated and lumpy chunks of poop, and 7 being very, very liquidy diarrhea. So types 1 and 2, if you notice that your poop is in those types, then you're probably in the realm of constipation, which means drink tons of water and get some fiber into you. Ideally, your poop should look more like 3 and 4. That's the healthy realm. should be easy to defecate, not uncomfortable, and it should be kind of formed in like a sausage or a snake formation. If you're moving towards 5, 6, or 7, you're probably more in the realm of diarrhea. So that could mean a couple different things, like either disease, or you ate something that doesn't quite agree with you, or that there's a bacteria imbalance in your large intestine. All right, so if we talk about what actually makes up poop, even though the large intestine's main job is to squeegee and squish and to remove as much of that water, to save that water, still 75% of our feces is water. The other 25% is going to be solid matter that's made out of the remnants of what we could not digest. So a lot of fats we won't absorb, we'll get rid of those. Things like dead cells and minerals, old bile, and also like dead bacteria. So that bacteria in our large intestine, when it dies, it becomes part of our feces. A fun fact, again, is every time you go to the bathroom, you should just take a look at that toilet before you flush to see about your general health. Poop should sink when it goes in the toilet. And the reason for that is that your poop really shouldn't have that much fat in it. If you have a lot of fat in it, fats and oils float. So if you have floating feces, it can be an indication that your diet contains too much fat and that your body's trying to get rid of it. And it'd be a lot healthier if you make better choices and you're not defecating all of that fat. The other part of feces is that in that feces, they're going to contain the bacteria that will start feeding on the indigestible carbohydrates. So along with poop goes the air that is produced as we make it. And that air is produced by these bacteria eating the carbohydrates and releasing a little bit of gas. In anatomy, the word for gas is actually flatus. And an average person will pass flatus or pass gas about 10 to 18 times a day, which sounds like a lot, but it's kind of healthy. These bacteria are doing their jobs and we got to get rid of it somehow. Inside of our intestines, we have this really cool thing called a microbiome. Really cool thing and really gross thing. We host over 1,000 species of microorganisms, and these microorganisms, usually are going to either be mutualistic, meaning they help us, or commensalistic, meaning they don't really hurt us, but every now and then we get an overgrowth of bacteria that can get out of control and can cause sickness. So a great example of that is a bacteria called C. diff. And if you have C. diff, it usually means you need to undergo a pretty intense round of antibiotics. The issue with humans overtaking antibiotics for every case of the sniffles and every tiny infection that you have is that it kills most of your microbiome, even the really helpful ones that we need for digestion. So in order to reestablish a microbiome in somebody who has gone through a treatment, an antibiotic treatment that has wiped out their microbiome, is to actually get a stool donation. So what that means is that these people come in, they donate feces, and then they plant a little bit of that feces into a person who is lacking that microbiome, and that can help all those little bacteria set up shop in this person, and it can help them regain a healthy gut function. All right. So last part of this just has a couple slides that I'll flip through. Make sure that you know and you feel comfortable with all the different parts of the anatomy and physiology of these digestive parts. So go through and label 1 through 14. You can pause the video here. And as you go through and label, here are the answers to them. You can go through and check. And then lastly, make sure that you're okay with all of these parts of the digestive system. Again, you can pause the video here. This part includes all of the accessory organs and ducts along with it. And here is the answer key to that. All right, so that was the digestive system, anatomy and physiology. Part 2 will be coming in a little bit that goes over digestive system disorders. I hope that was helpful.